CityCast Pittsburgh is supported by Fulton Commons. If you're looking for a gorgeous co-working space with lots of light and some truly wonderfully funky decor, check out Fulton Commons on the north side. The historic but very well renovated old school building is deep in the neighborhood by a park, tucked away but still super close to anywhere you want to be. They've got offices and common spaces. It's perfect for organizations or individuals, and they even have a shared food production kitchen on site. So there's lots of food-related events for their members. If this sounds like your dream co-working space, visit fultonpgh.org to request a tour. Today on CityCast Pittsburgh, our region is facing billions of dollars in cuts by the Trump administration to medical research through the National Institutes of Health and to Medicaid, which is how a whole lot of people here pay for their health care. Make no mistake, the decisions made today will have far-reaching effects for decades to come. Today, I am with 3 local doctors to talk about the very real impacts if this funding does go away and how they're trying to prevent that from happening. It's Tuesday, April 8th. I'm Megan Harris, and here's what Pittsburgh's talking about. I'm with Dr. Gabriel Cisneros, a pediatrician with UPMC Children Community Pediatrics. Dr. Gabriel, welcome.
Thank you. Thanks for having me.
Dr. Marian Jarlenski, a professor of public health at the University of Pittsburgh. Welcome.
Thank you. Great to be here.
And Dr. Adam Mueller, assistant professor of radiation oncology at the UPMC Hillman Cancer Center. Dr. Adam, thank you for coming.
Thank you for having me.
So I really want to ground us in the stakes here. Can each of you share one example maybe of how someone that you work with, someone that you treat, might be affected by the kinds of federal cuts that we're looking at? Dr. Gabriel, Dr. Gabe, let's start with you. I know you work with children.
Yeah, sure. So I'm a pediatrician, and so my job is to provide care to kids 21 and under when they're sick and also see them for their checkups. And so Medicaid, it turns out, is an important source of health insurance for many children in Pennsylvania. About 42% of children in Pennsylvania are insured through Medicaid. And so one example involves their checkups. Mm-hmm. So they'll come in, you'd say at their 1-year checkup, and need to be seen for measurements in their growth and developmental screening.
It's a really exciting visit.
Yeah, it is. Actually, the 1 year in particular, they're taking their first steps. They're saying their first words. I love it. It's great. And so Medicaid, or also known as Pennsylvania Medical Assistance, provides comprehensive coverage for their checkups. It helps identify problems early if they're, let's say, behind on their milestones. We can get kids into early intervention sooner rather than later, and it helps prevent problems from getting out of hand. So it's what every kid deserves and what we want for all our kids in Pennsylvania. And so Medicaid is really valuable in that way.
Yeah. I mean, if that money were to go away, would that mean that those visits are no longer covered in that way?
Right. That's the concern. So without that funding, their coverage is in jeopardy, right? So they may not be able to come in for those visits. It might get delayed, or parents may have to pay out of pocket.
Or skip them if they don't have those funds.
Or skip them entirely. Yeah, that's the concern.
Marian, what about you? I know you focus on pregnant people and infants who use Medicaid, and the number of people in our region who are on it is just staggering. I think I saw 250,000, 250,000 just in Allegheny County. How is this problem manifesting in your work?
Sure. Well, the proposed cuts to Medicaid are very concerning, but it's hard to really evaluate how they're going to affect our region until we see an actual proposal in place. So what I'd like people to know is that there are multiple ways that Medicaid could be affected. One could be something called a work requirement, which means that people have to document that they're working or in school. And past research has shown that that really increases red tape and reduces people's ability to enroll in Medicaid. Another is called a block grant program, and that's where the federal government gives a lump sum of money to states to spend for Medicaid. But that lump sum doesn't grow at the same rate of inflation that we're seeing for medical and other costs. And so that can lead to really dramatic cuts to the number of people who could be enrolled in Medicaid, which is concerning. And a third type of cut would be cutting federal funding for the Medicaid expansion group. And that group includes people who were covered under the Affordable Care Act, including adults who don't have dependent children and a lot of working class and poor parents. So any of these cuts could negatively impact families, including pregnant patients and kids.
And Dr. Marian, it's kind of wild to me to hear like some of these proposals, because a lot of the cuts that we're seeing nationwide, not just in the medical field, have to do with giving the decisions back to the states. But in this case, the state has been pretty unequivocal. We cannot take on this burden alone. We need federal support or we won't be able to offer the same level of care.
I think that's right, because medical care is so cost prohibitive for folks to pay out of pocket that we really rely on government and employer funding to do so. And to be able to cover people at scale, in Pennsylvania, we have 3 million people enrolled in Medicaid. It would just take a massive increase in taxes to do that. Alternately, it could affect other state priorities like education or transportation or economic development initiatives. And so that's why the federal match and the state-federal partnership has been so important to keep the Medicaid benefits as robust as they are.
Adam, what about you? I know you do a ton of work on cancer research. You also treat cancer patients. How are you seeing this play out?
So my patient population is a little bit less dependent on Medicaid since it tends to be an older population, though this certainly will have a tremendous impact negatively on the kind of poorer individuals who rely on Medicaid for their coverage, basically.
Yeah, but as I understand it, because our older population more often is on Medicare.
Yes.
But if there's a heavier burden on Medicare because Medicaid is gone, that can still have a huge roller coaster effect.
I mean, I think we're going to see this really have a spiraling effect on many of the systems if you kind of take one pillar of how, coverage is provided out. If anything, it will drive up costs by having less screening, by having less preventative care, and more folks showing up to emergency rooms with advanced disease because they really didn't have routine care. This happened a lot during COVID, where you had people forgoing screening and then, showing up with worse disease. And so we've done a lot of work to try to kind of get on top of, the screening and prevention efforts to be able to catch cancer when it is curable and treatable, and have less of that where, we're catching it at a very late stage. And, usually we can find some way to pay for people's care, but what ends up happening is it gets delayed to a point where that care becomes much less efficient because, people present at later stages. And so thus the treatment becomes more expensive and less effective.
Yeah, gosh, when y'all were becoming doctors, did you think you'd have to think about money and how people pay for this stuff on the level that you currently do?
I certainly did not. And it's really unfortunate because when you see a patient in clinic, you really want to be able to focus on how you and they are going to team up to improve their health and not think about how it can be, potentially bankrupting them.
Mm-hmm.
More than 10 years ago now, when the Affordable Care Act was passed, which allowed the Medicaid expansion as well as the marketplace plans known as Penny here in Pennsylvania, a lot of us were really excited because we thought, okay, now everyone can have health insurance, which is sort of like the floor. We want to build on that. We want to make the world a better place. We want to focus on health and well-being and getting more innovative treatments and preventing more diseases. And it just feels really frustrating that now we're back to having the same debate that we had 15 years ago about whether or not people should have health insurance. It just seems crazy. And I'd also like to share that Medicaid is a very popular program. Public opinion polling has found that about 75% of people have a favorable or very favorable view of Medicaid. And that's really across whatever political parties people affiliate with. It's a net positive public opinion for Medicaid.
Dr. Gabe, what about you?
I definitely didn't foresee the need to have to defend Medicaid. And the concern from our standpoint is if there's cuts to Medicaid, that would mean possibly less funding for our staff and the services that we provide, possibly longer wait times. That's why I'll just say that earlier this month, pediatricians from across the country came to DC to meet with legislators to ask them specifically protect Medicaid. This is not just a concern that we have here in Pittsburgh and in Pennsylvania, but all across the country. I think parents have asked, what are doctors doing about this? And so we're trying to show up and use our collective voice to advocate in support of Medicaid.
I mean, I feel like it's a terrible conversation to have at any stage of life, but to new parents, to young parents, like, if the question is like, does my child live in pain, or do I do something about it? Like that's horrible. That's a horrible conversation to have ever.
Yeah, I'm not sure that as many people are aware about what's being under consideration in Congress because there's so much that's happening so fast.
It's like drinking from a fire hose every day for all of us, I think.
Totally agree. So we're just trying to help raise awareness that this is something to pay attention to, and to contact your representatives in Congress, the House and in Senate, and tell them that this is important.
These programs aren't perfect, but they are actually quite effective. And when you look at the kind of administrative overhead of Medicare and Medicaid and the amount of care that they're able to provide efficiently, they're actually excellent programs. And I think most of us in the medical field would be much more interested to have a conversation about expanding these programs, about expanding care and coverage. And right now, I think we're all kind of in shock that we're looking at a situation of potentially going back to the bad old days where there is no safety net for an enormous portion of the children in this country, as well as the adults in this country.
And Dr. Marian, one of the things that, we've seen Trump administration talk about is that this is about fraud, Medicaid fraud. From where you sit, is that a problem at all, but also like a problem on the scale that it would warrant this kind of reaction?
Well, I think it's safe to say that we are all against fraud in our public programs. Our tax dollars fund the program.
That's very diplomatic of you.
I'm against fraud, for the record. I would like to highlight a report that came out by the HHS Office of Inspector General a couple weeks ago that found that Pennsylvania actually is number one in the country, leading the country in investigating cases of fraud in our Medicaid program. And so, again, just echoing what Adam said, it is an effective program, even including at combating fraud.
Today's episode is supported by the Pittsburgh Symphony Orchestra. If you're looking for a great night out, their Disrupt concerts are really fun. They're short, they're relaxed, there is no dress code, and you'll have a host on stage guiding you through the piece and bringing context to both the music and the person or people who composed it. You can even ask questions. There's one more Disrupt concert coming up this spring, Love Struck on April 10th, featuring a love story. Ravel's Daphne C. Chloe. You can expect shimmery romantic dreamscapes, ethereal progressions, and hypnotic harmonies that depict characters like nymphs and other mythical archetypes. The show is only 60 minutes long, and it's more than a concert. It's really an experience. Get there a little early, grab a cocktail, make a craft, and soak in the beautiful space alongside your neighbors. Tickets for Love Struck start at just $25. Get yours at pittsburghsymphony.org/disrupt.
Springfest at Lowe's means can't miss savings for your home and lawn. Right now, buy 3 bags, get 3 free on Miracle-Gro 3/4 cubic foot all-purpose garden soil. Plus, buy 2, get 1 free on select exterior paint and stain via mail-in rebate. Lowe's, we help, you save. Valid through 4/16. Excludes Alaska and Hawaii. While supplies last, selection varies by location. See rebate form for complete list of eligible products. Offer excludes clearance and mistints and can't be combined with any other offer, promotion, discount, or coupon.
So let's talk a little about NIH funding. So that's money through the National Institutes of Health. The Trump administration wants to cap costs, indirect and otherwise, though a lot of people are fighting this through the courts already. Adam, if these cuts do go through, how do you imagine it's going to affect research in our region?
Yeah, so, the NIH is the greatest source of biomedical research funds in the United States and, in fact, the world. So that is an enormous driver of innovation, of improving health outcomes. It's a catalyst for economic activity as well. There's an enormous return on investment for every dollar that the NIH provides to the institutions performing research, which for the most part are the universities around the country. And these universities are economic hubs for the regions that they serve. Certainly this region, Pitt and Carnegie Mellon, are enormous economic drivers for Pittsburgh.
We've made it our entire reputation. Like we have the whole category eds and meds. Like we want it to be part of Pittsburgh's identity. But let's back up a little bit. What does indirect cost? Like when the Trump administration says they want to put caps on that, what does indirect mean?
So when we apply for that funding, we have to very specifically detail how we are going to spend each dollar of what's called direct costs on the specific project that we are applying for. And then this is evaluated by panels of scientists and panels of career administrators at the NIH to make sure that that budget is appropriate for performing that specific exact project that we're doing. But beyond that, because the universities are so reliant on these research funds, there are a number of kind of ancillary and surrounding things that this grant funding pays for as well. Keeping the lights on, support staff, repairs, administrators, all these various things to essentially keep the organization running and keep those lights on. When we talk about, that funding, we know that for every dollar, direct or indirect, that the NIH pays out, that, a recent analysis showed that there was $2.5 of economic activity that generates. So the return on investment's very high. And if you look at regions like Pittsburgh that receive a lot of this funding and then have a lot of economic activity surrounding it, cutting those indirect costs will slash the budgets of the universities that are performing this research that has this enormous return on investment and puts an immediate chilling effect on our ability to perform that research. Unfortunately, because of that uncertainty, University of Pittsburgh went onto a hiring freeze. I personally was in the process of trying to hire a laboratory manager who was highly qualified for the position.
And lab managers are really important. They literally keep all the pieces in the right places. Mm-hmm. They project manage, they do a lot of things.
And, this individual was highly qualified and a single parent. And we got almost to the very end of the process. And, because of the uncertainty of the global budgetary concerns of the university, when that hiring freeze went on, I couldn't offer her the position. So I'm not able to do that work. She doesn't have a job. And then, her ability to participate economically in the economy of Pittsburgh is also obviously reduced. So this is kind of a lose-lose-lose to, have to essentially preemptively react to this potential slashing of funds. And when you look at it, the region of Pittsburgh may lose as much as $150 million to this kind of slashing of these indirect costs, which, it sounds, indirect costs makes them sound insignificant, but it's really what keeps the lights on at the places that are doing this research. Because as much as we can kind of dictate exactly how we're going to spend every penny when it comes to that exact project, it's not going to increase efficiency to also be able to put in a line item budget for the janitorial staff for every one of these projects. But those people are extremely important to be able to kind of keep the place running.
Yeah, I mean, you really want medical labs to be clean spaces. That's sort of pivotal to the whole process.
Exactly.
Get ready for Netflix's gripping new medical drama, Pulse. Set in a cutting-edge Miami trauma center, third-year resident Dr. Danny Sims is unexpectedly thrust into a promotion when beloved chief resident Dr. Xander Phillips gets suspended. Then, with the emotional and physical stakes at their highest, a storm will push the hospital and its residents to their limits. Witness how life can change in a heartbeat when you're operating under pressure. Watch Pulse, only on Netflix.
This episode is brought to you by Temptations Cat Treats. Your cat will come running for the perfectly irresistible Temptations Creamy Puree and Temptations Lickable Spoon Cat Treats. The best time to feed lickable cat treats to your cat is anytime. Feed by hand for a playful moment, in a bowl for a creamy treat, or as a topper to make mealtime fun. Visit temptationstreats.com to learn more.
I have to imagine, just stepping back a little bit too, that changes in immigration policy could be weighing a lot into this too. Recruiting brilliant immigrants to the U.S. is in part how, as a nation, but certainly here in Pittsburgh, we have achieved all that we have, especially in recent years. H-1B visas were so difficult to get before, and now as a nation, we have capped them further. And just the not knowing what's coming next, how is that affecting the work that y'all are able to do day to day?
It's so great to come to work at an institution where we have attracted people from all over the world who want to work on projects that will advance human health. It's such a joy. So in my lab, I actually employ 2 people on H-1B visas, and they're critical to our research operation. And it's really terrifying to think that something unpredictable could happen to them, or potentially even unsafe, because we just see these horror stories in the news. I also want to say that NIH is not only cutting indirect costs, they're terminating grants and not issuing as many new grants. And that puts the folks who work with me who are on H-1B, that puts their job at risk if a grant is unexpectedly terminated, despite the fact that we all have a good performance on the grant. And the number one thing I would say to listeners of this podcast about the NIH cuts is that it's a direct economic issue for the Pittsburgh region. It's a major economic issue. And I would ask why our 2 senators of Pennsylvania voted to keep the NIH funding levels at the same level that they were last year. But then NIH is allocating significantly less grant dollars and even clawing back and canceling grant dollars, because it's really going to hurt our local economy.
It'll hurt the local economy in the short term, but I keep thinking of all the people who are in college right now, are considering postdocs, are, in medical school. I have to imagine this is going to have such a chilling effect, and all of the breakthroughs and milestones in research that we won't get because this money is getting hung up now.
That's right. And it will hurt our ability to attract students to the area of public health and medicine as well. If these cuts are already doing that with our doctoral and postdoctoral. In fact, one of the grants that was terminated at Pitt was a training grant for postdoctoral trainees in addiction medicine here in Western Pennsylvania. So I think it's pretty obvious how that can be harmful.
This term brain drain has been thrown around, but it is going to happen, and it's starting with folks that are being deported for unpredictable reasons. And you see, other countries are starting to try to actively recruit American scientists and physicians, given all this uncertainty about the financial considerations. And frankly, it's an incredibly long pathway to get to the point that any of the 3 of us have gotten here. And there's a lot of, there's a lot of disincentives to really pursue science when you could often take a shorter road that pays better to be able to do something else.
Yeah. Dr. Gabe, I'd love to hear from you too. Bring us into, I guess, the resistance. What are y'all doing to try to combat what's happening in Washington? Or at minimum, I guess, let people know about what's happening in Pittsburgh.
Sure. Well, I can talk a little bit about how Adam and Marian and I have connected.
Mm-hmm.
We basically have met through a group chat of doctors here in Pittsburgh who are trying to keep up with the information that's being passed along and understand what's happening and how it's affecting the work that we do, and also come up with ideas for ways to speak out and use our voices. And so together, we've grown from just a small group in a few days to a large group of over 100, and we're calling ourselves Pittsburgh Healthcare Workers and Scientists. So we've are working on letters, and we're contacting our representatives, and we're participating in rallies. Feel free to contact us. We are a growing group, and hopefully together we can have a positive impact on this effort.
Well, if someone's listening to this, first of all, how do they get in touch with you if they are healthcare? But if maybe they're not healthcare, but they just really care about this, how can they help too?
We're on Blue Sky, PGHS, Pittsburgh Healthcare Workers and Scientists. Follow us and the information that we're putting out.
Yep, I'd encourage people to speak up whenever they can. So come to a rally, bring a sign about health and healthcare. Definitely call your elected officials if you care and let them know you care. And if your elected official votes the way that you ask them to, I always call the next day and say thank you, and say that I'm appreciating that, you are voting the way you are. And then finally, there is a lot of misinformation out there about some of our public health tools in our toolbox. And I wanted to say a word about vaccines. And I think one thing everybody can do is get vaccinated, get your kids vaccinated, and tell your friends and family. If people have questions about vaccines, tell them, I got vaccinated, it's fine.
Mm-hmm.
I got the flu and COVID and HPV, so just combating that, any kind of anxiety or misinformation with your own experience can be just a really positive thing to do.
And if you want to know doctors' opinions on vaccines, I'd say about 99% of us go get them as soon as we very well can and get as much as we possibly can of it. I have an 11-month-old child, and we're very concerned about the spread of measles. And, we actually got him vaccinated a month early with the MMR vaccine because of that concern. These are effective tools to prevent devastating illnesses. And we're certainly always happy to talk to people about the concerns that people have about them, to reassure them that these are really powerful and beneficial things.
Adam, Marian, and Gabe, thank you so much for joining us today.
Thank you.
Thank you for having us.
Thank you. It's been a pleasure.
That is all for today here on CityCast Pittsburgh. If you are listening and you want to reach the doctors, please let us know. We are happy to put you in touch. You can call or text us at 412-212-8893. We'll be back tomorrow morning with more news from around the city. We'll talk to you soon. Our first name's okay. Usually that's what we do, but I also don't want to not say doctor. Y'all worked very hard for that.
Perfectly fine with that.
Okay.